Ozempic's anti-aging secrets, fighting inflammation, health benefits, and daily habits for longevity. Hi, I'm Dr. Tony Weston. Recently, there's been a lot of buzz around the new drug Ozempic, not just for its role in managing diabetes and weight, but also for its potential anti-aging effects. Today, I want to dive deeper into this news and explore how Ozempic may slow aging by reducing inflammation. And because Ozempic is expensive and not right for everyone, to discuss daily habits we can all adopt to naturally reduce inflammation and enhance our health. Ozempic was originally developed to treat type 2 diabetes and is now making headlines for its broader health benefits. Recent studies suggest it may slow the aging process by targeting chronic inflammation, a key factor in many age-related diseases. Inflammation is our body's natural response to injury or infection, but chronic inflammation can lead to a whole host of problems, including heart disease, diabetes, and even accelerated aging. You'd be quite surprised at how many of the major health issues are linked to chronic inflammation. So I'm going to list them. Firstly, cardiovascular disease. In atherosclerosis, chronic inflammation can lead to the buildup of plaque in the arteries, increasing the risk of heart attacks and strokes. Inflammation is associated with high blood pressure, hypertension, which can further strain the heart and blood vessels. Secondly, diabetes. With type 2 diabetes, chronic inflammation can cause insulin resistance, a key factor in the development of type 2 diabetes. Inflammation can also worsen diabetes with complications such as kidney disease and neuropathy. Thirdly, with cancer and tumour growth, chronic inflammation can create an environment that promotes the growth and spread of cancer cells. There are also some specific cancers, such as cancers of the colon, liver, pancreas, and stomach, that are particularly associated with chronic inflammation. Fourthly, with autoimmune diseases. In rheumatoid arthritis, the immune system mistakenly attacks our joint tissues, causing inflammation that leads to pain and joint damage. With lupus, inflammation affects multiple organs and tissues, leading to a wide range of symptoms. With inflammatory bowel disease, conditions like Crohn's disease and ulcerative colitis involve chronic inflammation of the digestive tract. Fifthly, with some neurological disorders, Alzheimer's disease is associated with chronic inflammation of the brain, and this leads to the progression of Alzheimer's and other neurodegenerative diseases. In depression, inflammation has been implicated in the development of depression and other mood disorders. Sixthly, chronic respiratory diseases. So firstly, asthma. Inflammation in the airways leads to asthma symptoms such as wheezing, shortness of breath, and coughing. Chronic obstructive pulmonary disease, or COPD. Chronic inflammation of the lungs causes COPD, which includes emphysema and chronic bronchitis. Seventh, metabolic syndrome. With obesity, inflammation in fat tissue is linked to metabolic syndrome, which increases the risk of heart disease, stroke, and diabetes. In liver disease, chronic inflammation can lead to non-alcoholic fatty liver disease, NAFLD, which can progress to liver cirrhosis or liver cancer. 8. With some chronic pain conditions. Fibromyalgia. Chronic inflammation may play a role in the widespread pain and fatigue experienced by people with fibromyalgia. Chronic fatigue syndrome, CFS. Inflammation is also suspected to contribute to the persistent tiredness in CFS. 9. Skin disorders. Firstly, with psoriasis, this autoimmune condition causes rapid skin cell turnover, leading to scaling and inflammation. With eczema, inflammatory responses in the skin cause itching, redness, and swelling. 10. osteoporosis, and bone loss. Chronic inflammation can lead to increased bone resorption, weakening bones and increasing the risk of fractures. 11. Aging. Accelerated aging. Chronic low-grade inflammation, often referred to as inflammaging, is believed to contribute to the aging process and age-related diseases. So 11 areas of health conditions, and what makes Ozempic particularly interesting is its potential to reduce this chronic inflammation, which could explain its anti-aging effects. While Ozempic shows promise, it's not the only way to combat inflammation. Our daily habits play a crucial role in managing inflammation and promoting longevity. To naturally reduce inflammation, consider these key habits. Firstly, adopt an anti-inflammatory diet. Focus on whole foods like fruits, vegetables, lean proteins, and healthy fats. Avoid processed foods and sugars. Secondly, stay active. Regular physical activity helps reduce inflammation. Even a daily walk can make a difference. 3. Manage stress. Chronic stress can exacerbate inflammation. Practices like mindfulness, meditation, and deep breathing can help. 4. Prioritize sleep. Poor sleep can increase inflammation, so aim for 7 to 9 hours of quality sleep each night. 5. Maintain a healthy weight. Excess body fat, particularly around the abdomen, can drive inflammation, so weight management is key. While the science behind Ozempic's anti-aging effects is still emerging, it's clear that reducing inflammation is a powerful tool for promoting health and longevity. By incorporating these daily habits into our routine, we can take control of our health, whether or not we're using medications like Ozempic. Thank you for joining me today. If you've enjoyed this video, please like and share with others who you might think benefit. Subscribe for more videos on living a happier and healthier life. Stay informed, stay healthy, and take small steps each day towards a longer, healthier life.